Hello everyone, my name is Karen Yuba, and today I'm going to be presenting on metacognition and remote learning, and how it has been an overlooked global health challenge since the pandemic. But before I get into that, I want to introduce myself. Currently, I'm a rising senior at the Gwinnett School of Math, Sciences, Technology in Georgia, and my interests revolve around neuroscience and psychology. For activities, volunteer at church and my hospital, and currently I'm doing meta-memory research at Kennesaw State University with my mentors. But I will acknowledge in the past, I conducted a project on meta-memory and the relationship it has with the remote learning during the pandemic. But you're probably wondering, what is meta-memory? Well, meta-memory is a subconstruct of metacognition, which in broad terms is the ability to think about thinking. And what that means is that people are able to reflect and understand their cognitive processes and improve them. But in more specific terms, going back to metamemory, that specifically focuses on the knowledge, awareness, control of our memory processes, which is important in education. However, with the onset of the pandemic, it may have been negatively affected because the remote learning disrupted the lives of thousands of adolescents and exacerbated social isolation. So now that peers were distanced from their um, teachers and fellow students, these students more than ever needed to be able to self regulate their learning without having that teacher check in or the ability to work with other students to understand content together as easily. Further, past research has also shown that students who have stronger metacognitive skills tend to be more successful learners. So that's why this is not just a global um, educational problem, it's a global health issue because it affected more than 1.6 billion students. And because the pandemic, caused a lot of school closures, that school closure today is still causing learning losses in reading and mathematics because students may not have grasped key concepts back then that are hurting them today. So that's why disruptive learning isn't just an educational problem, it's a global health issue that is impacting the cognitive development and health of students across the world. So that's why for my research project, I wanted to investigate the relationship between metamemory and the months remote learning students had. And I will concede, I did not find statistically significant of a relationship between the two, but I did see that there was a consistent pattern. Because in this survey with metamemory, there were three subconstructs of it. There was memory satisfaction, perceived memory ability, and memory strategy use. And what I did notice was that there was a trend that students with longer durations of remote learning tended to have and report lower satisfaction and lower perceived capability in their memory. And that's really significant because that means that there needs to be more awareness and more research in this area. Because if students don't have confidence in their memory abilities, if students don't learn to self regulate early on in life, they are going to struggle with mental health and socioeconomic barriers in the future when they struggle in school and can't attain high education that it will really benefit them in the workplace and in the workforce. In addition, children during this time, if they don't learn to self reflect and regulate their executive functioning, like working memory and planning during this time period, it's really going to help, um, it's really going to hurt their cognitive development and how they succeed in education in the future. And even without disrupted learning scenarios, explicit teaching of memory strategies and metacognition is often not employed in school. So students may go throughout their entire education never explicitly learning how to reflect and think about their learning. Oftentimes, students are taught what to know, but not how to think. So that's why future research should integrate metacognitive training into everyday curriculum and fund research that links cognitive health, learning, and the global development of children. So that's why, for me, I already know I'm going to continue identifying specific cognitive gaps related to remote learning and see how, with metacognitive interventions, I can improve and help students improve, their metacognitive strategy use. So these were the references, and I'd like to acknowledge my teachers, mentors, and parents who guided and supported me during this project, and the participants who chose to participate. If you have any questions or would like to contact me, here is my information on the left, and thank you for listening.